Do you have back pain or neck pain for that matter, gone to a doctor, had an x-ray taken and told you just have degeneration? Have you been left with this diagnosis, not really knowing what to do, worried that it might lead to surgery, worried that it might lead to long-term pain medication, and are you looking for alternatives? Don't worry, you're not alone. Hi, my name is Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation, fellowship trained in primary spine care, and I've been managing patients for over 25 years with degenerative disc and other degenerative spine conditions. Now remember, these videos are not a substitute for a thorough evaluation, for medical or chiropractic advice, or for treatment. They're simply for educational purposes only. So let's just start with degeneration. This is a very scary diagnosis for somebody to be given. And we know this from the research because researchers have found that a lot of patients are really frightened with this diagnosis. So just what is degeneration? Well, first of all, it is typically not a disease. The first and most common form of degeneration is called osteoarthritis. And that is simply a biomechanical wear and tear of joints and tissues that occurs over time. So first of all, how does this begin? Well, it can begin several ways. First of all, it can begin through unbalanced or uneven wear and tear as the years go on. So think about the front end of a car. Let's say it's out of alignment. I mean, you can drive from here across the United States, but you're going to have uneven wear and tear on the axles, on the bearings, and on the tires. And it's going to show as time goes on. So repetitive motion can be part of it. Trauma can do that too. So a really, really hard trauma, such as a sports accident or a motor vehicle crash, can damage tissues internally, and that area can wear and tear at a different rate as time goes on, and then it will degenerate faster. The other thing that'll do it is prolonged inactivity where there's compression. Compression on tissues, it's not good. We know that people that lay in bed for long periods of time, if they're not moved, they can develop bed sores. So that is how wear and tear, repetitive motion, trauma, and even compression can give you some problems with the tissues. So what does degeneration look like? Well, I have a model right here that I'm going to show you. And this right here goes from normal through the various stages of degeneration. So I'll go over that very briefly with you. This right here is a plastic model of a spine. So if we look at you from the top down, this right here is a normal healthy disc. There's the center, there's the circular fibers, it's called the annulus. Looking at it from the side, you've got the vertebral body, and you've got these little bumps back here that are called the spinous processes. If you reach back and touch the back of your neck, touch your lower back, these are the bumps that you feel. Muscles attached to these, and it creates leverage so that there's motion. As time goes on, you can wear out these soft discs. You can even wear out the joints in the back. Joints are where two bone surfaces meet. There's cartilage, and everything is held in place so it can pivot. As time goes on, you can see how this disc looks a little bit thinner than this one. However, if there's too much wear and tear, your body will put down some calcium and start to cement it. So you can start to see how there's these lips and spurs and hooks right here on the front that you don't see on this other degenerated one. Looked at from behind, you can see how that joint surface looks different than this joint surface over here. So that's what your body does in response to mechanical overload over time. It starts to harden the tissues. Now, sometimes the tissues will harden and we can't really see it on imaging. It's just some of the limitations that we have on imaging. But it doesn't change the fact that those tissues are not functioning the way that they originally were designed to. Over time, these tissues can become painful. So degeneration or osteoarthritis, those are the ones that we're focusing on here in this brief video. These are ones that develop gradually over time. And not everybody who has degeneration is going to have pain. However, the more degeneration that a person has in a certain region, the pain likelihood, the pain risk increases and elevates. And we'll talk about that in some of the other videos. But I hope this helps you understand just a little bit about what spine degeneration, especially in the disc and even in the facet joints, looks like. You have a lot of different videos to pick from. I'm honored that you chose this one. If you or anybody you know is suffering from degenerative spine conditions and would like an opinion other than drugs and surgery, please give our clinic a phone call. We'd be more than happy to evaluate you and see if you are a good candidate for chiropractic care. Thank you so much for watching this video, and until we meet again, be blessed.